Dr. Gordon, and diabetes is a disorder in which the body cannot function properly due to complications with glucose and insulin. There are two different types of diabetes, type 1 and type 2. Type 1 diabetes is when the pancreas cannot produce insulin, which leads to high blood sugar levels, and cells can't take in glucose. Type 2 diabetes is when the insulin receptors are incapable of responding properly. In order to diagnose someone with diabetes, we must take either a glucose tolerance test, where their blood is drawn and they check glucose levels before and after consuming sugar, or a fasting plasma glucose test where no other foods are consumed to check the levels. If a patient has diabetes, then their glucose and insulin levels are checked. If their glucose level doesn't return to normal, or their insulin levels are stable, then they are most likely diabetic. Some common symptoms include frequent urination, constant thirst, weight loss, hunger, or dizziness. Some pharmaceuticals and treatment options that are available to diabetics include insulin injections, metformin, which maintains your blood sugar levels, exercise, maintaining a healthy diet, and monitoring blood sugar through finger pricks. All of these tend to help stabilize conditions. For the most part, type 2 diabetes can be avoided by living a healthy lifestyle and keeping your body in shape. However, type 1 is usually genetic and can't be prevented, just treated. There are many complications of diabetes, but one of the more serious is ketoacidosis, which is caused by a buildup of ketones in the blood due to the body's inability of using glucose to create ATP. As a second source, the body turns to lipids or protein to make ATP. High levels of ketones can poison the body. Ketoacidosis is a very serious complication that could lead to death or a coma. Because it is caused by a lack of insulin, in order to prevent this, a diabetic must take insulin injections or possibly get an insulin pump. Insulin pumps are small computerized devices that delivers insulin to the body in either steady or a surge dose. Here is a diagram of ketoacidosis and how it works in the body.
Hi, my name is Jessica and we're here with Hannah, and she's going to tell us a little bit about herself and her life with diabetes.
Well, I've been struggling with type 1 diabetes for about a year now, and it's kind of rough. I have to constantly monitor my blood sugar and exercise, and I have to take daily injections. I also have to maintain a balanced diet that lacks large amounts of glucose, carbs, lipids, sodium, and cholesterol. I have to obtain a lot of fiber, vitamins, calcium, iron, and foods that are high in protein like lean meats, legumes, and nuts. My primary care physician and diabetic educator informed me of my options and explained what's going on with my body.
Is there anyone else who supports you? Does this hold you back from doing any daily activities?
Well, I see a dietitian every once in a while that always gives me tips on how to stay motivated and keep up my healthy habits. But I've distanced myself from a lot of my friends because they're always out having fun and eating whatever they want. And I can't eat like most people, but I can do some stuff. Like I play sports and I exercise 5 times a week for about 30 minutes.
Oh, okay. Do you ever worry or have any daily concerns?
I just wish people would understand what position I'm in. I can't go anywhere without my insulin pumps, and if I do, it's the scariest thing ever.
Oh, okay. Well, there you have it. Here's Hannah. You're Hannah, right? Okay.
Making my way downtown, walking fast, faces pass.